What about the argument, if you could speak to that, maybe the cure is worse than the disease in terms of how we're all modifying? I mean, can you just be candid about what you think about that? Just saying, well, certain number of people die from stuff, all of different things every year: heart disease, diabetes, the flu. Just let this run its course, and survival of the fittest is kind of how we should approach this.
Yeah, I mean, I would just in those their patients, like my parents, and and many other grandparents out there. I just think that's a little bit of a hollow argument in my mind. The difference here is, and we can argue that some of those things you mentioned are modifiable, potentially preventable, but they're somewhat harder to prevent because it requires real prolonged lifestyle change,
Sure.
Committing to exercise and eating green, healthy foods and things of that nature, right? But this does have, I just feel like the sacrifice that we're asked to make for our fellow human being is something we just got to do, because otherwise lots of Americans, lots of people in the world are just going to senselessly die when we could have potentially just turned off our economy for a little bit and saved 1 million people. That's got to be worth something, right? And
it has to. And the other thing I don't like about this argument about maybe car accidents or heart disease or hypertension, and people die of all kinds of medical ailments. If I eat too many cheeseburgers, I can't infect you with my, and trust me, I eat too many cheeseburgers. That's not the point. The point is, COVID-19, I can infect you with my behavior. So that's creating I don't know if victim's the right word, but you're definitely been violently impacted by my behavior if I didn't modify it.
Yeah.
And that's a different type of disease that's preventable, because we can just prevent it by not having the contact that creates the transmission.
Yeah.
And it's different than saying, I need to eat more healthily and greens and it's
great,
different.
Great point. And I think absolutely that this, by locking down, that we can decrease the transmission of this disease.
Well, I loved what you said about it being a hollow argument, because my dander's been up. I've been a little frustrated with that consistent narrative, and if I can use, if this podcast, and if I get at all frustrated about communicating something, is that type of thinking is deadly to a huge part of the population, in that it's so hollow and insular, because you're not arguing apples to apples.
Right.
It's not even relevant, and it's not even an argument that makes any sense from a scientific perspective.
Yes.
I understand people die of the flu every year. That's despite a lot of things that we provide in a capitalistic society, free flu shots.
Yeah.
How serious is something, Dr. Pai, that you can get something for free in this country?
Yeah.
As a capitalistic society.
Yeah.
And despite every doctor visit I ever have, they tell you to get a flu shot.
Yep.
Every time I take my kids to the doctor, get a flu shot. Yep. And despite that, you can go to Meijer and Metro Health and all these places to get free flu stuff. And despite that, 30,000 people still die and won't get the flu shot.
Yeah. Right.
Okay?
Yeah.
So let's not pretend that COVID-19 isn't a big deal.
Yeah.
We do take the flu seriously. We shouldn't just say 30,000 people, will die, and because COVID-19 is this thing, certain amount of people are going to die anyway. It's not the same thing.
And I think, Brian, that's a good point. The flu shot's unfortunately is not 100% preventative of getting the flu. And certainly a percentage of those 30,000 people that may die annually of the flu didn't take some of those preventive measures that may have been able to help them. But I think the one thing that's just really, really different about this disease is the relative virulence, the ability to infect so many.
Yeah.
And then the order of magnitude, when you're talking tens of millions, that gets people thinking, right? And the one thing about the flu that's quite different is when you get real influenza A or influenza B, you are knocked down.
Yeah.
And you just close your door, you get in the covers, you take Tylenol, ibuprofen, you drink water, you cannot eat food.
You're just hanging on.
You're just like, I'm trying to make it. And then your infectivity there is lower because you're down. The problem here is there's a fair amount of people that don't go down. They have minimal stuff, and that creates their normal patterns of stuff they do, and that creates opportunity to infect a lot of other people.
That's a great point and a perspective that I hadn't thought of till this
Yeah.
conversation. I
Yeah.
mean, that really does. I mean, when you're sick with the flu, you can't go anywhere.
Yeah,
you don't want to go
You
anywhere.
just can't, you don't even think about it. You're just
Right.
trying to get till 3 or 4 days down the road when this passes,
Just
right?
let me crawl out of
Yeah.
this at some point.
Right.
And this is not how people, that's the challenge with this particular
You're not
type
going
of
to
virus.
Disney World with the flu, right?
Yeah, exactly.
You're not doing that.
Yeah, you're not going to South by Southwest,
Yeah,
or
right,
you're
yeah.
not transmitting or getting on a pleasure trip to on Delta somewhere.
Yeah,
It's a different thing, and you can with COVID-19. That's what makes it so dangerous. Well, I got a little fired up there, but
No worries.
This Full Exposure Podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.